You're listening to Focus on the Community, brought to you by Harris Regional and Swain Community Hospital. And today we have Dr. Marshall from Harris Wound Healing and Hyperbaric Center. Thank you for being here today.
Thanks for having us. Thanks a lot.
All right. I know we highlighted yesterday that September is PAD Awareness Month. So if somebody doesn't know what PAD stands for, tell us what that is.
Sure. PAD stands for Peripheral Arterial Disease. And it is a medical condition that anybody who is over the age of 50, anybody who smokes or has smoked in the past, anybody with diabetes or someone with hypertension or high blood pressure or kidney disease, any of those people can develop peripheral arterial disease.
All right. And some of the risk factors, like we were talking about yesterday, are smoking, high cholesterol, high blood pressure, diabetes, heart disease, obesity is on here, a family history maybe of a disease like that. So if that's you, be listening to some of these. I want to go over a few of the common signs and symptoms, just in case somebody may be thinking, something's going on with my feet or my legs down there. Could you give us some of the common signs and symptoms?
Sure. I think more commonly people will get cramping or they'll get pain in their legs, either at rest or when they're walking. People can also experience cold insensitivity, or one foot or leg will feel cooler than the other one. And that's also a sign or symptom of developing PAD.
Okay. And so once somebody has PAD, they find out that that's really the cause. How does the Wound Care Center treat that?
So what we'll typically do, patients who are having these sort of symptoms, they'll usually go to their primary care provider, whether that's a doctor or a nurse practitioner or their PA. And then those symptoms should trigger their primary care doc to say, hey, this patient may be developing PAD, and they'll send them to either a cardiologist or a interventional radiologist who will look for signs and symptoms of PAD. And that usually starts with an arterial brachial index or an ABI, where you're testing the blood flow down to the feet and seeing if it's normal or not. If it's abnormal, then there are things that can be done to improve the blood flow and to help, basically treat PAD before it happens. There's a few medications that the patients can get put on sometimes that will improve the blood flow. There's interventions that can be done, like minor surgeries and things like that. If they have PAD and it gets bad enough to when they develop a wound, either on their foot or their toe or their leg, that's when they'll typically get referred to see us at the Wound Care Center. So we're not there to treat the arterial disease. We're not there to treat the underlying medical condition. We're there to treat the wound itself if it occurs. And a lot of people end up going to the emergency room because they let these wounds go for a long period of time. For whatever reason, they don't want to go see their primary care doc, or maybe they haven't gotten set up with one yet. So they go to the ER, and the ER will send them directly to us to take care of the wound. And then we have to kind of do the investigative detective work and figure out, all right, why is this wound there? And we can check ABIs at the Wound Care Center, which we do all the time. We'll check a person's ABI, check to see if their blood flow is compromised to their foot. If it is being compromised, then we will refer that patient to the right doctor, or we'll order them the right X-ray so that we can figure out exactly what's going on, what's causing the wound. That's really important.
And I know that you guys are not only just the Wound Healing Center, you're also a hyperbaric center. So if somebody doesn't know what a hyperbaric chamber is, would you explain a little bit about what the machine itself looks like and what type of patients go there?
Sure. So the hyperbaric chamber is a long cylindrical clear chamber that people will lay down in, and the chamber shuts and it's clear, and patients will oftentimes be watching their favorite TV show on the screen.
Which is good that you have a distraction there for people who are claustrophobic.
It's nice. It's nice and cool in there. It's not warm. You're able to talk to the hyperbaric oxygen technician who's at the bedside for the entire treatment. So you're never left alone in there, and you're chit-chatting with them the whole time or watching your favorite show. But it's great for it. What it does is it delivers a super concentrated oxygen to your tissues to help your tissues remodel and heal faster than normal breathing oxygen, which is 21% for you and I right now. So that's delivering hyperbaric, super atmospheric pressure oxygen to those patients, to their wounds, to their tissues, so that those wounds heal in a faster manner.
And if somebody had PAD, would this be one of the treatments that you would use if it was severe enough?
If it's severe enough. So Medicare has, and the government has given us standards, and people have to qualify. People have had to have met those standards. And part of that is undergoing sort of a treatment process that you have not, that has failed basically before you're a candidate for hyperbaric oxygen treatment. And that usually involves a wound with bone involvement, with infection of the bone, and that patient has had to fail antibiotics for 6 weeks, I believe. And that's usually, those antibiotics are usually given by an infectious disease doctor. And then if all of that hasn't healed the wound, then they usually qualify for hyperbaric oxygen treatment.
And one of the things I think is pretty amazing that Harris Hospital is that we have access to this treatment right here in our community, right here in Jackson County at Harris Hospital at the Wound Healing Center there. One of the things that you guys do is you have some intervention partners that you work with as a doctor.
Correct.
Talk a little bit about how you partner with people in our community to help bring the best care.
Correct. So the most important part, in my opinion, of wound care and wound healing is figuring out why the wound is there. The wounds dressings and things like that we put on are, they help wounds heal. They help control the infection, but they aren't the reason. They're not figuring out the reason why they're there. So people have wounds because of PAD. People can get wounds because of the veins in their legs don't work the way they used to. People can get wounds from cancer, can get wounds from radiation, can get a wound from a burn. If their hand is stuck in a paper mill, a traumatic injury, they can get a wound. We need to figure out, hey, why is this wound there? Is it because their diabetes is not controlled? And we can fix that. So we work, we try to figure out why the wounds are happening, and then we'll send those patients, we'll refer those patients to the right specialist to help improve that. If it's PAD, we'll send them to the interventional cardiologist, and we have one at Harris that can go in there and basically roto-rooter their arteries and clean them out.
Wow.
For lack of a better word.
Yeah.
They'll clean the arteries out and really dramatically improve the blood flow to the feet and help those wounds heal. And not only help them heal, but help prevent them from getting more wounds. The other thing to do is to check their veins, the blood flow from their feet back up to their heart, because that can cause wounds too. And if they're not having the veins do their job, we'll send them to the specialist that can fix their veins as well.
Which is fantastic. So we've been talking all day about Harris Wound Healing and Hyperbaric Chamber. Not only do they treat patients with PAD, which we've been talking about because it's kind of an awareness campaign to get people to get information about that, but you treat other wounds as well.
Absolutely. Yep.
All right, so we're going to talk more about that tomorrow. Thank you for being here today.
Thank you. Thanks for having us.
You've been listening to Focus on the Community, brought to you by Harris Regional and Swain Community Hospital.